This is Lacey, and she's agreed to allow us to use her as a model for this particular procedure. We have scheduled a facelift and some associated procedures that we're going to talk about today. She has had some plastic surgery before on her eyelids. It's been about 15 years since she had her uppers and then her lowers done, but we're not going to be doing that today. I'll start with just a top to bottom exam, and then we'll talk about some of the technical particulars. I love this, a nice smooth forehead with a well-positioned brow. So again, when we talk about brows and what we like to see in a woman, the feminine ideal is a nicely arched brow that thins as you get lateral and that is positioned with about 1 centimeter above this bony rim right here. So she's got that. We're not going to mess with that. Looks great.
Thank you.
Upper and lower eyelids have already been done. That's not an interest for her. Her primary concern is some of the wrinkling, some of the volume loss. She used to smoke, but quit 11 years ago, maybe longer.
Longer, yeah.
But oftentimes what we see here with these sort of vertical lines around the mouth are associated with smokers, but we don't necessarily see it in just smokers. A lot of people get those even without smoking. So we say kissers lines.
Yeah.
That sounds better.
That sounds a lot better, doesn't it? Yeah.
Some of these deep lines here we're going to address also. And then, of course, we're going to address the extra skin on the neck, the early jowling that we see here. And we're going to do most of that with a facelift. The facelift scars are going to start, in her case, the way she wears her hair, short with sideburns, are going to start, in her case, right here, just in front of the sideburn. Again, sideburns are a natural and normal anatomic feature. We want to respect that. And one thing I hate to see is a missing sideburn where someone's had a facelift with this sort of different scar pattern and just pulled the sideburn out and removed it. We like that sideburn. So it's going to start there, go up behind this part of the ear. This is called the tragus, down below the earlobe, and then, may I turn your head, Lacey? Then follow this crease right up behind the ear. And again, right here you can see a really nice transition between the two different types of hair on this part of her scalp, and we're going to use that to conceal the scar. Again, taking care we match up that hairline very nicely and don't distort any of her natural anatomy. Through those incisions, we're going to tighten up the skin. We're also going to tighten up the facial muscles and some of the muscles on the neck so that we get some longevity out of this. And we're going to do a couple of other associated procedures. Right here, you may or may notice that this distance is elongated. That's the distance from the base of her nose down to the top of her lip, the pink part here. And we're going to do what's called a bullhorn procedure. We're going to remove a little bit of skin and fat underneath the skin right here to, if I can do this for just a second, like lift that up and shorten that. Smile for me. And then just open your mouth and relax. We don't see a lot of upper teeth, and that's, again, because the lip is elongated. That's called dental show, and it's nice and attractive feature to see some of your lower teeth. We're also going to do some fat grafting and inject a little bit of fat right here. Of course, this will all be lifted and elevated by the time we do the facelift, but we're going to do some fat grafting here. Fat grafting to soften or efface these lines, fat grafting to volumize the lips, both upper and lower, and help with those wrinkles and help give a little bit more vermilion show. That's the pink part of the lip, and we want to see a little bit more of that. We're going to do all that in the operating room. A couple of other things we're going to do is just resurface the skin to help with the texture. And we're going to reduce her earlobes. We don't talk about that much, but as we age, our earlobes get danglier, looser. We're going to reduce the earlobe. I like to do it in a way that's going to put the scar just on the edge and on the back, so that's not going to give any visibility, but we'll see that in the afters. Any questions, Lacey?
I don't think so.
All right. Look forward to seeing you again.
Thank you.
All right. Good to see you again.
Good to see you.
All right. Thanks for tuning in. It's Chad Robbins here with Robbins Plastic Surgery, and we are back with Lacey. We are 8 weeks out from a facelift, and there were some technical modifications that we'll discuss here today, some things we did in the OR, and we're here to evaluate our results and do an exam today. She says she's happy. I believe her.
I am happy. Very.
when we talk about facelifts, obviously we don't all age the same way. For a lot of people, it's skin laxity and skin excess. For a lot of people, it's volume loss. And there are specific anatomic areas that are more troublesome to some people than others. So when we talk about facelift, we just describe it as a facelift. But in this particular case, Lacey had some signs of skin laxity. She had some volume loss. There were some specific anatomic areas, specifically her lip and her earlobes, that we did some extra things, and I'll go into detail on that. But at any rate, we addressed all those things. First few weeks, there's some swelling, bruising. We're through all that now, and we can evaluate our results. I'm really happy with the way this particular case turned out, and I'll describe kind of in detail what we did. So she had already had her eyelids done previously. We didn't do anything to her eyelids. We did a standard face/neck lift because we did some work on her neck also, and scars. And she wore her hair like this before, which is nice. But I took care to stay in front of the hairline here because I didn't want to distort her sideburn. That's a telltale sign. Went back up here behind the tragus, this part of the ear, and then of course the scar comes up here. See, can I show them your scars?
Sure.
The scars are nicely concealed. That's what an 8-week-old scar looks like, at least a good 8-week-old scar. I'm happy with how that turned out. And so that conceals real nicely. So with that, we did some work tightening and removing skin excess. We also used the muscles on the face and the neck to sort of suspend that and redefine those areas, especially down here on the neck. So we did some work on the neck muscles to give her a sharper angle here, work on the muscles of the face and neck to get rid of jowls, and so to bring this part of her face up, give her a little bit more of a heart-shaped face. And she provided the other features already, the lovely ice blue eyes, which are so gorgeous. She had an elongated lip and not a lot of lip volume, so we did a lip lift. This is called a bullhorn lift that we did right here, and the scar is concealed nicely underneath the nose, but we shortened her lip. We also used a lot of fat grafting. We sucked some fat out of her tummy and inside there, and isolated those fat cells, put some in to restore some cheek volume, restore some volume around her mouth and lips, and I was happy with the way that turned out. She had droopy earlobes, and now they look really nice. Can we show off your earlobes here? Really nice, youthful earlobes, and we put a little bit of fat in there too, to help with that. And then we did a TCA, which is a 35% TCA chemical peel to sort of restore and resurface the skin. So. Thanks again for tuning in. I appreciate your attention. As long as you're watching us, we'll keep making videos. Thanks again for coming in. Well, I appreciate that.
Sure, not a problem.
All right.
Proud of it.
Yeah, good.
Yeah.
Good.